Well, welcome back, everyone. Listen to this number. It is just unbelievable. Every year, more than 795,000 people in our country experience a stroke. It's the leading cause of serious long-term disability and the top 5 cause of death.
But strokes can be prevented. It's Stroke Awareness Month, and this morning we've brought in Dr. Teddy Wu, the co-stroke medical director for Memorial Hermann, to discuss. Good morning, and thank you for joining us.
Oh, good morning. Thanks for having me.
Explain to our viewers, what exactly is a stroke?
Yeah, it's a great question. Sometimes it does get confused a lot with people. A stroke, simply put, is dysfunction of the brain due to disruption of blood flow. And the two ways that occurs is when a blood vessel actually gets blocked by a blood clot, so the blood can't get to the brain cells. And another type of stroke, which is called hemorrhagic strokes, is when the blood vessel actually ruptures. And when that occurs, the brain cells does not get the blood flow, the oxygen and nutrients that it needs, and then it causes damage to the brain cell itself.
When we hear that amount of people who are suffering from a stroke, you just can't help but wonder, what are those risk factors? What are some things that could lead to this?
Yeah, so the common risk factors for ischemic stroke, or that blockage type of stroke, which occurs about 85% of the time, is very similar to other cardiovascular disease. So high blood pressure, which is totally treatable, diabetes, high cholesterol, and lifestyle modification things that, when people either smoke, those things are also risk factors as well.
Now, the Be Fast method of recognizing, this is not just for someone who is having one, but for someone who is around noticing someone having a stroke. Explain that.
Well, absolutely. I think it's very, very important to recognize signs and symptoms of strokes, because oftentimes the person that's having the stroke aren't going to be aware that they're actually having one. So the Be Fast acronym actually stands for B for balance. So sudden onset of balance issue, difficulty walking. E is for eyes or vision. So all of a sudden they have difficulty seeing or double vision. F is for face, so when they have asymmetrical smile. A is for arm, so when the arm drifts on one side or the other. And S is for speech, difficulty either talking, slurring, understanding. And T is ultra important, which is for time. Anytime somebody recognizes those symptoms, either themselves or somebody else, it's really important to call 911 immediately so they can see medical attention.
Get them help, and don't waste. The faster you get there, the faster your chances are to recover fully, right? Let's talk about a lot of myths involved with strokes as well, including that they can't be prevented, but sometimes they can.
Yeah, over 80% of the strokes are actually very, very preventable if we tackle all the risk factors that we mentioned before, specifically high blood pressure. It's very easily treatable. There's a lot of medicines and health lifestyle modifications that can help to reduce high blood pressure and the other risk factors that we've gone over: high cholesterol, diabetes, and lifestyle modification changes, including a healthy diet.
Now, Memorial Hermann has sort of a quiz, so to speak, that someone can take to find out about the risks as well as the symptoms.
Yeah. The quiz is available online. I'm sure we're going to be able to give that information out, and they would be able to take that quiz to see how much they know and fill in the knowledge gaps for those viewers out there, to get them more educated about that subject.
And I think it's so important for people to realize that this is not something that happens to elderly people. It can happen at almost any age, right?
Right. So stroke risks do increase with age, like most diseases. However, about 25% of the strokes actually occur in patients that are under the age of 65. So we often do see young patients that come into the hospital with stroke. So it can affect all ages.
It's an amazing situation. Dr. Teddy Wu, thank you so very much for joining us.
Thank you for having me.
Potentially life-saving information coming from Memorial Hermann.
Well, thank you so much for your time.
All right.